Now, coming to something called as genomic imprinting. I think this is a very important concept. Here we are going to learn the concept of Angelman and Prader-Willi syndrome. And I cannot stress any more on the importance of this particular topic, because Angelman and Prader-Willi syndrome, the basis is very difficult to understand. Although at the end of the understanding, you just have 2-3 sentences to memorize and mug up, because in the exam, you will not obviously rewire the concept in your mind, but you just need to know exactly 2-3 lines. But you need to understand the concept. It is a very difficult, interesting, and also to some extent, if you know it, you will never forget it. So I'm going to explain you that mechanism. You see, I've explained this in such a nice detailed way. I'm going to come to this, but before that, I'll just take you through some basic points. Now, what is the meaning of imprinting? Imprinting means silencing. Imprinting means silencing. It is just as simple as that. If you talk about maternal imprinting, it means that the maternal gene or the allele is getting silenced. It is no more getting expressed. Okay. Now, why does this imprinting and how does this imprinting happens? It is because of DNA methylation. Number 2, because of histone H4 deacetylation, and number 3, histone H4 methylation. These 3 mechanisms take place, because of which this imprinting mechanism happens. Now, how exactly is it significant, in the generation of a disorder or a syndrome? That we are going to learn here. Very important. Let's go through some basic points before I come to the difficult part. Prader-Willi is characterized by intellectual disability, short stature, hypotonia, profound hyperphagia, obesity, small hands, feet, and hypogonadism. It is striking that in all the cases, the deletion effects is paternally derived from chromosome 15, and whenever you talk about Angelman syndrome, they also have intellectual disability, but in addition, they have microcephaly, adaxic gait, seizures, very important, and inappropriate laughter, because of which they are called as happy puppets. Now, these clinical features are very important. Angelman में क्या होता है? Happy puppets होता है and seizures होता है. Very important points. And Prader-Willi में क्या होता है? Hypogonadism होता है, hyperphagia होता है. Very important. Intellectual disability is present in both of them. Now, the chromosome involved here is a long arm of chromosome number 15. Very important. Chromosome 15 is involved here in both these diseases, but the imprinting mechanism is different in both these syndromes. So I want to explain these two syndromes side by side. These two are basically comparisons of each other. One is just the opposite of the other. So what are the mechanisms involved here? Number 1 is the deletion. Okay? Number 2 is the disomy, and number 3 is defective imprinting. This is not something which is important. Two very important mechanisms. Number 1 is the deletion, and number 2 is the uniparental disomy. Now, I'm not going to go through any of this, because it will be very confusing if I go through this. Before I come to that genetic part, I just want to mention one point here, and that is, in the Angelman syndrome, you have this gene called as UBE3A, which maps the 15q12 region on the paternal chromosome, which is imprinted on the paternal chromosome. And this absence of UBE3A inhibits synapse formation and synaptic plasticity. So these two are again interconnected. This is a point I wanted to mention. Another point here is that with the Angelman syndrome and the Prader-Willi syndrome, you have this SNP family of gene, which also encodes some nuclear RNA, and the loss of SNP functions is believed to contribute to Prader-Willi syndrome. So loss of SNP functions, they have a connection with the Prader-Willi syndrome. Important question. And the absence of UBE3A is connected with Angelman syndrome. Very important question. So if I can just highlight this for you, Angelman में absence of this is important, and in the loss of SNP is important in the Prader-Willi syndrome. So these two are just something I wanted to highlight before I come to the main part. Now, this is a very important part, and I want you to pay very good attention over here. I've already mentioned what are the two mechanisms I'm going to try to explain over here. Number 1 is the deletion, and number 2 is the uniparental disomy, right? These are the two mechanisms that I'm trying to explain here. So basically, what is imprinting now? So basically, what is imprinting? Imprinting, as I mentioned, this means silencing. So if I say you it is maternal imprinting, means there is silencing of the maternal allele. And if I tell you paternal imprinting, there is silencing of the paternal allele. Now, प्लीज अंडरस्टैंड दिस पार्ट इज द नॉर्मल क्रोमोसोम. ठीक है, ये नॉर्मली होता है. नॉर्मली क्या होता है? नॉर्मली क्या होता है? नॉर्मली इन द मैटरनल, दिस इज मैटरनल एंड दिस इज पैटर्नल. ठीक है, दिस इज माँ एंड दिस इज पापा. ओके, सो maternal क्या होता है? दिस इज व्हाट इज हैपनिंग नॉर्मली. नॉर्मली इन द maternal gene you have an imprinted Prader-Willi gene. Means imprinted, the word imprinted means silencing, inactive. So in the maternal chromosome already the Prader-Willi gene is absent, inactive, not functioning. And in the papa the Angelman gene is imprinted or inactive, not functioning. You must understand one thing very importantly, and that is, if I tell you what is Angelman syndrome. Angelman syndrome means the Angelman gene is absent in that particular individual. Okay, if I say that this patient is having an Angelman syndrome, which means that in that particular patient the Angelman gene is absent. And if I tell you what is a Prader-Willi syndrome, it means that in that particular individual the Prader-Willi gene is absent, it is inactive, it is not functioning. The patient is having that syndrome because that particular gene is not functioning in that particular individual. Okay, so see, Angelman gene is normally imprinted or normally inactivated on the paternal chromosome. So in the paternal chromosome, the Angelman gene, A for Angelman and PW for Prader-Willi. So Angelman gene is normally inactive or imprinted on the paternal chromosome, and the Prader-Willi gene is normally imprinted on the maternal chromosomes. So this Prader-Willi gene is normally imprinted or inactive on the maternal chromosome. This is what is happening normally. ठीक है, अभी क्या हो रहा है देखो. अभी let's talk about this particular aspect. ठीक है, तो अभी क्या हो रहा है देखो. This was what was happening normally. Now if there is deletion, this is the first mechanism I am discussing. If there is deletion of the maternal chromosome, so initially क्या हो रहा है कि in the father there is already inactivation of the Angelman gene. There is no Angelman gene in the father. Already the father is not having any Angelman gene, but the mother was having one Angelman gene, right? A was active here, so mother was having Angelman gene. But if now this mother's gene is getting deleted, if there is deletion of the maternal chromosome, then what will happen? The father was anyway not having any active gene for Angelman. The father was not anyway having any active Angelman gene. The mother was the one who was having this active Angelman gene. And now when the mother's chromosome is getting deactivated, from where will the bacha get the Angelman gene? Right? Now this child is having no Angelman gene because father में तो वैसे भी नहीं था, ठीक है, and mother में था लेकिन that got deleted. So when there is a deletion of maternal chromosome, the gene, the active Angelman gene which was there in the mother is no more there because it got deleted, and in the father there is anyway there is inactive Angelman gene, anyway there is no gene over there, no functioning gene over there. So gene ही नहीं है, Angelman का जीन ही नहीं है अभी after this deletion, and therefore that is giving rise to Angelman syndrome. Understood this point? So this same thing, if I kind of talk to you regarding the Prader-Willi syndrome now, same thing. Prader-Willi में क्या हो रहा है कि the gene, the active PW gene is present in the father. The mother is anyway having an inactive gene. The mother is anyway not having any active PW gene. It is active in the father. But now when this father's chromosome is getting deleted, when there is a deletion of the paternal chromosome, then ultimately the father is having no gene because it is deleted now, and the mother was anyway having an imprinted gene, silenced gene, inactive gene. So now from where will the child get this active PW gene? There is no active PW gene, and therefore the child is not having any active PW gene, therefore the child is having PW syndrome. So when I say that a child is having Angelman syndrome, means the child is not having any active Angelman gene. Okay, so this is the mechanism. I hope that you understood this. very important. Deletion क्योंकि क्योंकि एक जीन इधर मदर में है, because one gene is either present in the mother or the father. If you take the example of Angelman, that is, then the Angelman gene is normally present on the mother. But when the mother's chromosome is getting deleted, then from where will the child get the gene? The father chromosome was anyway not having any gene. The father chromosome was anyway getting imprinted. The father's Angelman gene was anyway imprinted, silenced. So the child was getting the gene from the mother. But now when the mother's gene is, or the chromosome is getting deleted, then there is no point. Ultimately, the child has no gene. So the child is having the disease now. Okay. So if you talk about this, see, so Angelman में क्या हो रहा है? There is maternal deletion. Maternal deletion हो रहा है, and therefore we say maternal imprinting. Maternal deletion हो रहा है, and therefore we say maternal imprinting. Okay. In the ma, this was normal. This is normal. Okay. And if you talk about this, this is the abnormality. So Angelman में maternal imprinting or deletion हो रहा है. Preterably में there is paternal imprinting or deletion. So yes, paternal deletion gives rise to PW, and maternal deletion of chromosome gives rise to Angelman. So this is what is the basis. Difficult to understand, but this is ultimately what you have to remember at the end of the day. But again, you know, sometimes sentences are framed and concepts are framed. So nowadays, I don't know, their questions are not asked. Sometimes they give twisted questions. So it's always good to know the concept. Okay, and imprinting happens in the same region of this chromosome 15, right? Now the only thing which is left to understand, and that is the uniparental disomy. अभी इसका क्या concept है? If you talk about a uniparental disomy, if you talk about the Angelman syndrome, I told you that in the Angelman syndrome, the mother was having the active gene. So what is happening in the Angelman is that there is uniparental disomy of the paternal chromosome. Very important point. Angelman is having disomy of the paternal chromosome. So Angelman में क्या हो रहा है? The father's gene is getting, you know, duplicated. Disomy, duplicated. Father's gene में तो वैसे भी कोई active Angelman gene है ही नहीं. So the father is not having any active Angelman gene. So if the father is not having any active Angelman gene, the father's chromosome was anyway not having any active Angelman gene. So if the father's chromosome is now getting duplicated, both these chromosomes is not having any active Angelman gene. Therefore, whenever the father's chromosome is duplicated or there is a parental disomy, ultimately there is no active Angelman gene giving rise to Angelman syndrome. And therefore we say in Angelman syndrome we have paternal disomy, because if it was maternal disomy, then the mother is having the active gene, then the bacha will not have the disease. So in Angelman we have the paternal disomy, means in the father was anyway not having any active Angelman gene. The father's chromosome, which is devoid of any Angelman gene, is now getting duplicated, or disomy is happening. So that makes no sense, because obviously this chromosome is not having any active gene. So isko aap disomy kar lo, trisomy kar lo, ultimately there is no gene here. So therefore the bacha will automatically not have any gene. Similarly, in the PW syndrome also, the mother is anyway not having any active gene. So if the mother's chromosome is now having trisomy, whatever, it doesn't make sense, because from the mother, whatever chromosome you give to the child, ultimately it will not have any active PW gene. That's why the child will have the PW syndrome. So Angelman में disomy of paternal chromosome, and PW में disomy of the maternal chromosome. Very important. Don't forget this. Angelman में there is maternal imprinting, but there is disomy of the paternal chromosome. Very important point. I will try to highlight this once more over here, that see, Angelman में you have maternal imprinting, but you have paternal disomy. ठीक है? I will just write this down over here. because it's a very very important point. This is basically your formula. So in Angelman equals to maternal imprinting, or maternal deletion, is equal to paternal disomy. ठीक है, this is going to be your basically formula. This is going to be your formula, and this is going to be just the opposite in case of Prader-Willi. If you talk about Prader-Willi, then you have paternal imprinting or deletion, and you have maternal disomy. ठीक है, I hope that this is the formula, this is the ultimate formula that you have to keep in mind. बाकी जो भी है मैंने समझा दिया है, the concepts and all I made you understand, but this is the ultimately the end of the day, this is what you have to remember. ठीक है, so I hope that you are able to understand this part. This is what is explained over here, and I'm not going to go through the details now because you'll again get confused. So this is how we come to the end of this chapter. Now this molecular genetic diagnosis, in which we have 4 important points: this karyotyping, PCR, FISH, and sequencing methods, especially the NGS. All these things are important questions. So with this we come to the end of this chapter. I hope you enjoyed watching this video and learned something today. There were a lot of important concepts and a lot of important topics, which were not that concept based, but then the points are extremely important, and a lot of other concepts which are very important to understand. If you like my content and appreciate my effort, then please consider subscribing, and I would appreciate your valuable feedbacks and inputs into my work. If you have any personal query, you can mention down in the comment section below. I will meet you very soon in my next video. Till then, take care, keep studying, and thank you for watching.